Hi, thanks for coming to my channel for Student Nurse Autumn. And I'm doing a video about how to study for pharmacology. And if you've seen the previous video off of my channel, I was going to focus on study tips that I'm using and will be continuing to use in my own pharmacology class this summer. So I was waiting on my book for a while to come in, and it came in this yesterday, so I was able to get it. I want to show it to you guys. This is the pharmacology book. Okay, and I'll include in a description below in the comments the citations for that book in APA format. So if you want to try to access it or purchase it for your own benefit, you could on your own. I'm also going to, later on, I want you guys to stay tuned because I'm going to include how to access a learning style quiz to quiz yourself to see what type of learner you are. And the reason I'm bringing that up is it's really important to know what type of learning style you have because it's going to affect and impact on how you should study. For me, I know I'm a kinesthetic learner and I'm also a visual learner. So for me, hands-on things like making flashcards, videos, watching videos is really helpful for me. Reading out loud, I do find helpful. Discussion groups, study groups, different things. And this little quiz I'm going to show you at the end of this video, show you how to access it. It will really help you identify how you should study and what type of learner you are. So during this video, I wanted to mention more books to help with pharmacology. So I know in my last video I mentioned the pill book, and I'm going to show it again in this one as well. This is the pill book. It's the 15th edition, and it's the revised and new one. I'm going to include in the comment section citations for it so you guys could access it and purchase it on your own if you would like. I know through my nursing school, they have us use, it's called Nursing Central, or it's also known as Unbound Medicine, and it's an app that you can download on your phone or any mobile device, really. It could be Apple or Android, or your laptop. And I use mine on my Android, and it is pretty expensive. You do have to pay for it. If you're not part of that through your own nursing school, just disregard that. The reason I mention it, though, is the app that it uses, like the specific books that would be still helpful for pharmacology that you could purchase separately, is the Davis Drug Guide, 16th edition, and the Taber's Medical Dictionary, and it's the 23rd edition. So I'll include those in the comments tab below too, so you guys could see what they are for the citation, and you should be able to find them on Amazon, your local Barnes & Noble, maybe even some local bookstores may have them, but you'll find them to be really helpful because for pharmacology, you really want to be able to look up drug names, know classifications of the drugs based on the suffix of a pharmacology medication name, and the suffix is like the root ending of the word. So like an example we talked about in class today was like OLOL. So that's OLOL, and those are it's a type of cardiac medication for classification drugs for beta blockers, and you could look it up in your book. And so the other study tip I wanted to mention was flashcards, and I like things like this, little case packaging things to put your cards in and keep it neat. You could get those at your dollar store, Walmart, pretty much any store could have these. And the flashcards I like are the 3x5s, and you could get them blank, lined, colored, multicolored. These ones are blank, and I like these because there's a little more freedom to them. You could draw on them, write however big or small. I know I kind of write big, but they're kind of really helpful in that sense. And they're cheap, and the important thing with flashcards that I'm emphasizing this study tool for you guys is if you're going to use flashcards, do it where you're using it almost every day. Seriously, like you need to just carry your cards around, and anytime you're like just sitting and waiting, like if you're waiting for your doctor's appointment or you're you have leisure time and you find yourself like just kind of sitting, or if you're sitting in your car, not necessarily driving, because distracted driving is a not good scenario, but it really, studies have shown that the more you review material and you expose it continually, that's how you learn and you retain information. And flashcards that's exactly what it does, is it makes you review. And you know, I used flashcards my entire first semester of nursing school when I took I'm taking pharm right now. I used them all throughout my nursing semester last spring when I took fundamentals of nursing, health, aging, health assessment, and I took it with, I've used flashcards in all of my classes, even before nursing. So for me, they work, and being consistent with your studying tools, get a study group together, which is what I'm working on too right now, which is a little different because everything is from home still, remote online learning. And a lot of my study groups take place like featuring with Zoom meetings or like text messages or calls, and it works out pretty well. I'm still getting my study group together. And so yeah, that's like the best study tip I could give, is like consistency with using flashcards, and that's what I'm going to plan on using. And today we had our first day of class essentially, and it was with pharmacology and we talked online with a Zoom meeting, and we're going through the first chapters of our book, so chapters 1 through 4, and I'm so excited I got the pharm book. So I'll include a citation for all of those books below. And let's see. Okay, so I'm getting ready to end this video, and thank you for watching the whole thing with me. I'm going to include a link directly to the study quiz, and it's a free quiz you can take just to see what type of learner you are. And it'll be a brief, there's like 10 questions, right? And it also gives you a scoring key where you could you could add up your own score and see what kind of learner you fall under. And what's cool about this quiz is it also shows you, if you're this type of learner, you should do this and this. If you're this type of learner, avoid doing this, but do this instead. Like, it's really helpful, and it's focused on your type of learning. And, you know, overall, that's how you want to be the most successful, is identify your type of learning style and just study with those techniques. Stay tuned. So like in my future videos, I'm going to also probably include a video about like concept mapping, but instead of concept mapping on patient care, it'll be focused on drug classifications and what those drug classes are, what their side effects mainly are, you know. And before I go, I wanted to give a nice closing, because I had asked a senior in our nursing program. She just graduated this spring. I had asked her like 3 questions, mostly focused for pharmacology, and she did want to remain anonymous with this, but I wanted to share her answers. Okay, so I'm going to read the questions I had asked her. There were 3 of them. So, what study tips may you offer while taking pharmacology? Do we need any specific calculators? And in your own experience, what did you enjoy most out of the nursing program for CSU-Pueblo? And I want to share with you some of her responses. Let's see. Let's see, I'm pulling it up. Okay, so from those 3 questions, she had just said, for pharm, I suggest trying to make connections. This will really help better understand side effects and mechanism of actions. Some people do this by making small concept map type of things. Just play around and find something that helps and works best for you. Also try and make little tips on how to group medications together. An example of this would be focusing on the spelling of medications, such as beta blockers that all end in OLOL, O-L-O-L, which is what I had mentioned earlier. And for OLOL medications, she said, so instead of trying to memorize every medication, which would be way too much, she did say, instead of trying to memorize all of them, she said you should learn to just recognize them by their suffix. And it's going to be complicated, but it is doable. Another thing is to try really hard to not just memorize that stuff for the test. Really try to get an understanding of them. Then that'll help you, especially when you get to med-surg. Obviously, it's hard to do that with everything. Some things do just have to be memorized, but the more you get good at understanding these things, the better. And she said, I think any calculator would work. The math equations aren't too extreme. It's more about knowing your conversions. In my experience, the thing that I enjoyed most about the program was knowing that I wasn't alone. I'm not going to lie, it was very difficult at times, and I often felt very discouraged and frustrated, but it was nice to know that I wasn't the only one feeling that. I just felt like we were all struggling together, LOL. I also felt like everyone was willing to help each other out, and that's how it should be. On the same note, I met so many people that were amazing, and I know I will become lifelong friends with them. So that was just some of her own experiences, and I'm really glad she shared those with me, and I'm so glad I can share that with my channel. And thank you guys for listening. And for future videos, I do plan on including more details on pharmacology, specific examples of how to use concept maps into integrating like pharmacy types of concepts, like focusing on drug classifications and how to break it down of like side effects, mechanism of action, intervention. Like those are really important, something we apply in nursing all of the time. So thank you for watching, and like this video, share it, comment below, and thank you, and stay tuned for future videos. Have a good one.